Hi, everyone. This is week 6 in community wellness, and we are really moving along. I have finished most of the windshield surveys, community assessments. There's just a few that I'll still get back to a couple of the students, and I have entered the discussion points grades for the week. So really such a lot of work from all of you, and it is just always interesting to see the differences in communities and what their healthcare needs are. So just to talk a little bit about the assignments before we move into I want to point out some specifics about the content this week. Um, your assignment to post this week then is to put together a community wellness nursing care plan. And there are, I'm sure you've seen, directions and a rubric in, again, that lesson section that has all of the assignments in it. And I want to emphasize with you that you want to take now a problem that you addressed or highlighted at the end of your community assessment windshield survey and then work that through. Um, while you can use regular nursing diagnosis, I also have a copy of a chapter from Carpenito that really specifically speaks to community nursing diagnosis. So I have just found that helpful. There aren't a lot of them. There are about 5 or 6 of them, but they will match the deficit area that you've identified in your community assessment windshield survey. Along with that, you want to come up with both short and long-term goals. And just to re-emphasize, I usually look, and there are a number of ways of doing it, and I'm fairly open with that. But an easy way for me to think about it, a short-term goal would be what you want to accomplish along the way. So if you're addressing the issue of obesity, and we have a percentage of the residents in the town that are obese, your short-term goal, a nice or a fairly easy one to think about, would be in the next 6 months, you're going to provide an educational program for um, 10% of the citizens in the town. So, some target group, and you can use certainly different community service areas maybe to provide this education, the YMCA, senior center, to speak to parent groups, those kinds of things, and include in it, obviously exercise, good nutrition, meal planning. I think a lot of times people get into this fast food um, pattern because life is so busy. Everyone has their kids involved in lots of activities. People are working, they're going to school, and it's very difficult unless you do some fairly heavy duty pre planning to cook every night and make a healthy meal for the people in your family. So, that's also an excellent topic to think about. A long term goal then would be that the obesity rate within 2 years would drop by 5%. So, think about how you can structure those goals to both address what you're doing along the way with your program planning and then your end result. And then the interventions, you should have both short and long-term interventions, and these would be the kinds of things that you're going to do to accomplish this goal. These are the things that you need to have evidence-based. So you should go and look at the literature and it will tell you what works. We've been doing program planning in the community for quite some time, and there are certainly many guidelines and informational pieces that can give you literature, that can give you ideas of what kind of interventions have been successful in the past. And then your evaluation for this project is really, because we're not going to put this into play, we're not going to be looking at this again in 3 months down the road or 6 months or a year. What then statistical databases would you look at to prove that you have been successful? So that's kind of the gist of it. And again, just like with other assignments, if you have questions, please ask via email. Um, so that's due by Saturday. And again, I am looking at the grade book right now, and I don't think it's reflecting this assignment, or this post is not worth just 10 points. It's 20. This assignment used to be turned in as a separate assignment like the environmental report, and instead we have decided to post it so that everyone can get a look at it. or at least, again, students can look at their other fellow students' work and comment on it, and I think that's a really nice idea. Um, Another question that has usually come up at this point is, as you look at completing the community assessment, let me rephrase that. You've done that already. At the agency assessment that you're working with, that you're observing at, one of the questions on the rubric asks how do you translate scholarship into the practicum experience? And again, to be realistic for me, this is, while you were there and observing, did you research a topic during practicum that came up? So was there some kind of initiative that the agency was involved in and they were addressing a certain healthcare issue? Did you look up, what the literature tells us about it and what's effective? And again, if you're putting your teaching module together, that's the other assignment that's due then, those two towards the end of the course, um, you should be using evidence-based guidelines to put that teaching module together. So again, what is important to teach no matter what the topic is that you're addressing. So those, I think, are two easy ways that you can incorporate scholarship into what you're doing at the practicum site. And again, keep in mind when you're putting the teaching module together, please make it something that the agency can use. They always have many needs, and it can be addressed or geared towards staff education or for education of the clients that they're seeing. So moving on, you're looking at vulnerable groups this week, and just to, again, get a feel for it, there is content, but I have specific ones that I've certainly pulled out from the text, and which I think are ones that really need to be considered, because a lot of times when you're working with these agencies in community health, you are gearing, or services are geared to one or more vulnerable groups. So we look at the, again, just to highlight it, the elderly, the homeless. Definitely, this isn't a problem that's going away anytime soon. Another group would be, and it's very important, especially as we're moving into the spring and summer months, is the migrant workers. This is just a devastating group of health needs that we need to keep looking at and addressing. So pay particular attention to them. Obviously, the poor, again, another group that's not going away anytime soon. In fact, as we know, the space between people that are considered well off or wealthy and the poor is just, that middle ground is just continuing to disappear. The mentally ill, again, a lot. It's one of the needy areas when I continue to look at community assessments is the lack of mental health services that are provided in many communities. It's just kind of astounding. And then the disabled. So those are the ones that I think are really important to get a feel for. And I'm sure, as again, you've worked with the community agencies and observed what's going on, you've seen programming geared towards these groups. So just to point out a couple of terms that I think are important, or concepts, as you move through the PowerPoint on vulnerable populations. One of the terms that the textbook puts out there is something called human capital, and I think it's an important concept to consider. This is when we're looking at a client and you're trying to assess this, it's all their strengths, knowledge, skills that enable this person to live a productive and happy life. So you're really taking into account everything that positive that they have to offer to make their life a success. A few other things further down, this is on page 10, to really think about our role in advocacy. I know as I've commented on some of the community assessments, when we look at community collaboration and you're trying to get services provided that aren't particularly geared to health, although indirectly. So a lot of times in urban areas, we have just a total lack of groceries, which just seems so out of sorts that there wouldn't be a big grocery store in every neighborhood, but there isn't. And so when you're working on a project like that, trying to get companies to come in, or a chain to come in and provide that kind of resource for residents, that really is a good example of advocacy. And we can't do that alone. We have to have community partners to do that. It also speaks about social justice, that we treat everyone equitably and recognize the worth of all our citizens in our community. And one of the things that I came across and I thought was real interesting is in community health, they talk a lot about nurses and how can we improve the health status of the vulnerable. And one answer that continues now to come through is to build their resiliency. And that means that, again, we're going to help them deal with different forms of stress and problems in their everyday life, and certainly as it impacts their health status. And these are very simplistic, it seems like, ideas, but we want them to think about a healthy lifestyle, improving their nutrition, getting exercise, working on their emotional health, safety, independence, and improve their health literacy. So resiliency is very important in today's day and age with all that we're really dealing with. There are a couple of other terms, too, that I just want to point out, and I don't want to forget them. Um, is the terms, and I've added these to PowerPoint number 6. Sorry, I'm going a little backwards, but I knew that I had skipped over these. To think about how vulnerable populations can feel first disempowered, that they lack influence or importance, that they feel disenfranchised, which means that they have a sense of social isolation, and they don't feel like they are in with the mainstream society. And then the last one is they feel marginalized. So they are very powerless and they're unimportant and no one is paying attention to them. So think about really the impact of those statements and how devastating that could be to be living in a situation like that. Another thing I wanted to point out that I thought was interesting as you look at health disparities, they talk about 3 that Wisconsin is targeting, and this is to improve the infant mortality rates. We have a high infant mortality rate in Milwaukee County, Racine, Beloit, and Dane. They want to improve immunization rates for children, and they want to work on decreasing mortality rates from specific diseases like heart disease. So those are some interesting goals that the state has identified. The last piece that I really want you to think about is assessing a person from a vulnerable group, and really, again, opening up and including many other issues in your assessment to try to help link them with resources and identify what their needs are. Certainly, as a nurse, we're trained to assess a person systemically for physical issues that they have. I want you to take a step forward and think about what else needs to be addressed and how it can impact their health and well-being. So first of all, when you're working with groups like this, to really make it a non-threatening, comfortable environment. If they are of another culture, and we're going to talk a little bit about culture next week, that you really take the time to learn about their culture and what it means to them, including family in your interview or gathering data, and then to think about what other agencies can help them. History taking, again, trying to include those socioeconomic factors that really have an impact of even their access to healthcare. So financial resources, who can help them? Um, do they have any developmental issues that they're dealing with? Are they dealing with some kind of sensory deficit that makes it difficult for them to understand or to put healthcare practices into place? And again, what's their feeling about the healthcare issue that they have? What do they know about it? How do they understand it? Because that's going to also impact what they decide to do about it. And then other important areas, looking for signs and symptoms of abuse and neglect, talking to them about their environment that they're living and working in the environment where they live, thinking about insect and rodent infestations. What kind of water supply do they have? I read a lot about, well water supply and the dangers associated with it. Um, it, the condition of the area that they live. Is there peeling paint? Is the ventilation system good? Too much humidity can breed things like mold, and that, again, we know can cause illness in people. Um, Animal waste in the area, outside noise, violence that they're dealing with, safety. Those would be stressors in their environment, and then their sewage disposal. And I know everybody just kind of smiles when we talk about that, but if you don't have adequate safe water and adequate sewage disposal, you're going to have illness. Um, so those are just some things that I wanted to point out to you that I think might be helpful as you move through the content this week. Everyone is doing so well, and I just want to encourage you to just move forward. You're over the hump, and you have a few assignments to complete and some discussions, and you're really doing well, and I hope this has been a real learning experience for you. Um, so that's it for the week. And again, I'm sorry it's a day late. I was trying to get windshield surveys completed, and if I take time to do anything else, then it's sometimes hard to get back on track. So please get in touch with me if you need anything, and I hope everyone is doing well.